Where I think the polygraph is most helpful is in promoting people's honesty. And the reason that I think the polygraph is valuable is just to get such a comprehensive understanding. Like in a psychosexual, the information that you provide me, in regard to an individual's sexual history dating back to when they, initially were even just exposed to any kind of sexual information, their first sexual experiences, their exposure to pornography, whether they have ever engaged in any type of sexually deviant type of behaviors, I think is invaluable.
Welcome to Inside the Polygraph. I'm your host, David Goldberg, expert polygraph examiner. Join me as I and my guests break down the facts, fictions of polygraph testing, law enforcement, and so much more. Real cases, real conversations. The truth is always revealed inside the polygraph. Welcome to Inside the Polygraph with David Goldberg. I'm your host, David Goldberg. When I say this in reference to all my guests, I do not lie. I hold lying and truth to the highest esteem in reference to honesty. And I say that in reference to my life and in reference to my professionalism. Today, I am so thrilled to have this special guest on my show. Before I introduce this special guest, this woman is an impeccable professional psychologist, and she is highly sought after. But I am very honored and privileged to have her, and she rearranged her schedule to ensure that she would be on this episode, and I am very grateful. I had to go back into my records to find out how long have I really been working with this amazing woman. And I can tell you, she's not even going to probably know this, but I will tell you, we've been working together for over 16 years. We're going on our 17th year.
Wow.
And that's amazing to me. So, ladies and gentlemen, let me welcome to you this amazing woman, Dr. Alana Hollings, a forensic psychologist. Welcome.
Thank you so much. And thank you for that really wonderful introduction. I really appreciate that.
Well, that's just a brief introduction. Let me tell my listeners, my thousands of listeners, who you really are. Ladies and gentlemen, this is who this amazing woman is. Dr. Alana Hollings is a psychologist, a clinical forensic psychologist, and certified as a sex offender treatment provider. She earned her doctoral degree in clinical psychology with a concentration in forensic and completed her postdoctoral training at a maximum security forensic hospital in California. And I'm not going to present or tell you the city only because I don't want to mess up the city. She can tell you because to me, it's kind of hard to pronounce. In her full-time practice, she's been doing this in her full-time private practice since 2007. Dr. Hollings conducts forensic evaluations for state, military, federal courts, private attorneys, and the Department of Social Services. She routinely testifies as an expert witness on a wide range of legal controversies, including parental fitness, custody situations, trauma, child sexual abuse, trial competence, and mental state at the time of the offense. She also provides therapy to both adolescents and adults. Ladies and gentlemen, let me welcome once again Dr. Alana Hollings. Welcome again.
Thank you, David.
That is an amazing resume, obviously. And like I said in the beginning, I have worked with you for over 16 and a half years. That's amazing.
It is amazing.
So I have to ask this. I ask a lot of my guests, when you go to high school, you don't know what you want to do. You get career day, you see firefighters, police officers, lawyers, and you go, well, I might want to do that. You see engineers. Okay. Then you decide, you know what, mom and dad, thank you. I'm going to go to college. And you say, you know what, I want to be a doctor. I want to be a lawyer. I want to be an engineer. I want to get into music. I need to ask you, and I want you to tell my many listeners, what made you want to be not just a psychologist, but be a forensic psychologist dealing with some serious major issues?
So my path, and when I was in high school, I really enjoyed helping people. And so psychology was an easy choice. But there was always part of me that was really interested in the criminal mind. And at the time, I didn't know about forensic psychology in particular. So I debated between psychology and the law. And I wasn't exactly sure which route I was going to take. And then when I went to, so I received my bachelor's in psychology. And then when I was debating between going to law school or going to graduate school, I thought, well, maybe I'll get both degrees. I'll go get my law degree and my psychology degree. When I went to grad school, they had just started a program where they had concentrations, and they selected 3 to 4 individuals for each separate concentration. And so I was one of the individuals selected to do forensics. And so it was there that I really discovered that it was the combination of psychology and the law. So it seemed like the perfect fit.
Gotcha.
And in grad school, with having the concentration, my electives were all in forensics and my internships were all in forensics. So I got to go to prisons and meet serial murderers and go to mental health court and see the individuals who were maybe struggling with like prostitution and needed help as compared to people that had to go into the criminal system. So there was a really interesting experiences I got there. When I was in grad school, I got a job working for, this was in Fort Lauderdale, Florida, and I got a job with a man who had the contracts for sex offender group treatment. And so I started out at the bottom of the barrel. I was inputting MMPIs
Right.
on the computer, just like for hours on end, until he would allow me to run my own groups. And eventually, I ran 3 to 4 groups back to back, one after the other, of men who were on probation and were required to be in sex offender treatment.
That's amazing. So you are a very, very intelligent woman that was either going to go into both law or psychology. So you chose to combine them.
Yes.
And that's very, very, very impressive. Tell the listeners, there are many differences, obviously, but the issues that we spoke about, and we're going to get into them very deeply in this podcast, but in reference to parental fitness, custody situations, trauma, child sexual abuse, and mental state issues, both and victimization for adolescents and for children and adults. And listeners out there right now, and they're going through some of the same issues, let's say, and they want to just go to a regular counselor or a regular therapist, or obviously a psychiatrist that prescribes medication, tell the listeners the difference between them and your profession.
So one of the biggest differences, and a mental health professional can come in the form of a psychologist, a licensed professional counselor, or a licensed clinical social worker. And they can be skilled in providing therapy. When someone provides therapy as a provider, you are like an advocate for your client. You listen to them, you support them, you treat their presenting symptoms, you listen to their self-report, and you treat them based on what they're reporting. A psychiatrist, as you said, prescribes medication, and they may do therapy too, but they primarily prescribe medication. As a forensic evaluator, one of the basics, one of the most important things is being neutral and objective. So we don't align with one side or the other, and we make that very clear from the outset. Maintaining appropriate boundaries is incredibly important in order to not only do my job well, but also to maintain a positive reputation in the community.
And that's important.
Very.
So it's important to understand, and the same when it comes to my profession as a polygraph examiner, in reference to being hired by a defense attorney, which you would be, you're not a hired hand.
Correct. That's right. It's known to being a hired gun, someone formulating an opinion just because they're being paid by that person. And that is something I would completely avoid.
Right. And I have myself personally, I've been on the stand in even that has been brought up. And I'm adamant in saying that when I testify, that just because an attorney hires me or a client hires me, that no, I didn't pass them or I didn't fail them because one hired me. My opinion is not biased for one party or the other. My professionalism is based on the facts that are presented in front of me. And the same, I'm sure, goes with you.
Absolutely. I do forensic evaluations, and I'm sometimes hired as an expert witness or as a consultant to ultimately testify. And I do a very thorough analysis that includes a very extensive record review, multiple collateral contacts, as well as an interview with the party. And then based on what type of evaluation it is, I put those recommendations in for the court.
And that's very important to let the listeners understand that. In reference to these horrendous, and they are horrendous issues, I spoke about two major individuals on my last issue on my podcast in reference to pedophiles and sex offenders. And I'm glad that you are on this podcast because you are an expert, you are a professional, and you're going to be able to tell the listeners, even though I said it, but it's going to come out of you because you deal with it. There is a difference between a pedophile and a sex offender. Is there?
That is true. A sex offender is someone who commits a sexual offense. A pedophile is someone who has a sexual interest in prepubescent minors. And it is something that occurs for over a period of at least 6 months. And it's almost as if there are people who are born attracted to, most of us are attracted to adults, and it just is something we anticipate and expect. But from my experiences stemming from my work at the Forensic State Hospital, it is called Atascadero State Hospital in California. And I worked with sexually violent predators there. And it was very interesting because some of them were just attracted to minors. Now, there is sometimes an environmental component. Sometimes there are people who are severely abused or who have been exposed to various different types of trauma that leads them, that maybe stunts them at a particular age. But based on everything that I have learned, I do believe there's a genetic component as well. So if someone is attracted to prepubescent minors, they could also be attracted to adults. And so many of the men that I met, they could be married, but they also had this other attraction. And then there's individuals who are only attracted to prepubescent minors. This is something that cannot be cured. It is something that can be managed with appropriate resources in the community and treatment, but it is something that will not go away.
Right. And I mentioned that, and I'm so thankful that you have just emphasized that. In reference to what you do, and I do want you to tell the listeners what you do, in reference to when an individual is placed on probation after they've been convicted of being a sex offender, they are now sent to you for treatment or evaluation. What is the process that you go through as a psychiatrist or psychologist, psychologist, that you do your evaluations on that individual?
So it's very important that if I am doing an evaluation, I would do that first prior to starting any type of therapy. And the reason I do that is because as a forensic evaluator, as I stated earlier, my role is to remain neutral and objective. And my role as a therapist is different because I am more in a supportive nature and a teaching role and an advocate for that individual. So I wouldn't want that to get muddied. And so I would always do the evaluation first. And I do sex offender evaluations at different points. Some of them are court ordered, and that usually occurs prior to the individual being sentenced, where they've already been, they've either pled guilty or have been found guilty. And then oftentimes I'm hired by private attorneys to evaluate their clients, sometimes to help with negotiating a deal with the prosecutor if the results turn out to be favorable for the client. Um, Also, sometimes it just helps the attorney in determining how to litigate the case, and also to know whether or not this is an individual that should be in active treatment. And oftentimes they will refer them to me for treatment after I complete the evaluation.
And your evaluation, whether it's pre-sentence or after after sentencing, you have guidelines in reference to your evaluations. Am I correct?
That's correct.
And you all, in your evaluations, it also shows whether or not they have a propensity of recidivism. Am I correct?
So there are different tests. And just to be clear, no test is perfect. But we do have certain tests that look at whether an individual has high sexual interest in prepubescent minors. There are also a test that I give that assesses for like sexual knowledge, um, acknowledgement of behaviors, past deviant behaviors, as well as any cognitive distortions or thinking errors that helped facilitate their misconduct. Um, there also are risk assessment tools, such as the Static 99R, that is a 10 factors that have been heavily researched,
Right.
that do speak to recidivism risk.
Okay. Have you been accused of one of the following in your life, such as infidelity, custody matters, CPS investigations, or serious criminal matters that you're currently being investigated for? At Executive Protection Group Polygraph Service, we have been helping thousands of individuals for over 24 years, no matter who you are or what you have been accused of, with the highest accuracy, integrity, and overall compassion to everyone's needs. We are not your typical polygraph or lie detection service. At Executive Protection Group Polygraph Service, we are certified experts recognized in courts throughout the country, and we stand by our promise to give you full closure and all your needed answers. Call at 757-495-1301 and visit our website at www.executiveprotectiongrp.com to get started. In reference to these sex offenders that either are court ordered to you or a private attorney that sends their client to you, obviously it is based on cooperation, number one. And number two is when they do go to you, based on their cooperation, do they have to come to you on multiple occasions, or is it a one-time deal?
So typically it's over a couple of sessions. The testing is pretty lengthy and extensive, so some of it depends on their own stamina and
Right.
ability to get through it. My interview is a couple hours,
Mhm.
and I will schedule that. So I just try to work with the individual based on like where they live. If they're coming from a far distance, sometimes we just try to schedule everything in one day so they don't have to make 2 trips.
Very good. And I want the audience and the listeners to really, really understand this, especially from you. I can say whatever I want and people can, disagree, but hopefully coming from you as an absolute expert, and I definitely admire. Sex offenders and those that commit crimes on adolescents and very, very young, when they get convicted and they come to you, it's not a one-shop all in reference to the individual that comes to you. Am I correct?
That's very true. I see a wide range of individuals. Oftentimes, most recently, I'm primarily seeing individuals who are struggling with pornography addiction, and that has led them to look at child pornography or possess the material, for which they are looking, obviously, at incarceration and convictions. But oftentimes, I will be providing treatment for that, which is very different than treating someone who, let's say, is attracted to minors and we're trying to prevent them actively committing a contact offense.
Right. And that's what I said prior was there's a difference between viewing child pornography and being hands-on.
That is very true. And this is something that I don't believe is well understood. What the research shows is that the majority of men who have been convicted of possessing or looking at child pornography will not go on to commit a hands-on contact offense.
Right. And what I said was, and tell me if I'm wrong or correct me and say I'm right, is because of many factors. One, either they didn't have the opportunity to have hands-on. Two, they are afraid to get caught, or they don't want to, and it's just they're getting their sexual gratification just based on the visual observation of the pornography.
I think those are accurate statements. I also think that because of the internet and because of the accessibility of child pornography, a lot of men who maybe never would have seen this material now have access to things that they never would have before. And so we're seeing a lot of before, like years and years ago, if there was an individual who was looking at child pornography, it was very likely they were a pedophile because they were actively finding ways to seek it out. Now, a click of a button, and it's just very, very easy. And then it's almost like when people look to see a car accident, it's something so shocking and so something they're like, oh my gosh, that they almost can't turn away.
Right.
So sometimes they feel disgusted, but they keep going back to it. Sometimes they are aroused and they are like, what is going on? But their body is responding to images that they just had never seen before.
Correct. In reference to parental fitness, tell the audience what that means. What do you have to evaluate in reference to that?
So a parental capacity evaluation is often referred when individuals are in the midst of some type of custody litigation. Sometimes there are accusations about one party or the other. I know you and I have been on multiple cases with that, where one of the parties is suggesting that the other party touch the child or stares at them while they're doing diaper changes.
Correct.
Or makes some other kind of accusation against the other party. Typically, it's the mother making allegations against the father. The father will typically deny the allegations and say that that did not happen. And so, but a parental capacity evaluation does not address issues specific to custody. I will not make a recommendation about that, but I do look at the relationship between the parent and child. I do some psychological testing. I do parental assessments that looks at parental knowledge, the relationship between the parent and child, any type of stressors in the parent-child relationship, any red flags that would signal abuse or neglect. And I also look at the co-parenting relationship. So at the end of that type of evaluation, I put in recommendations, whether we need reunification therapy or whether there is, if there was like, I don't typically use this word, but if there was alienation from one side or the other, recommending some kind of, that's where reunification would come into play, or even doing co-parenting therapy to strengthen the parenting relationship in terms of improving communication and trust and the ability to collaborate and make decisions for their children together. I'll also put in just guidance of where exchanges might be held or that the parties can't agree on phone calls or FaceTime calls. And so we put some parameters around those type of things just to give some guidance to the court.
And you mentioned that you and I have worked on many cases like that. And of those cases that I've handled and you've handled and we've handled together, the individuals that are hurting the most when that happens of false allegations by one parent to another parent, it's normally the child. Am I correct?
Absolutely.
And what I've noticed in my profession, and I'm sure in your profession, is it's always about power and control when it comes to a parent making a false allegation.
There is, and that it's not even just with sexual things, but oftentimes this issue of power relinquishing control and allowing the other party to parent.
Right.
Is
exactly
a consistent theme.
And that's what it is.
Yes.
Right. And so that's where it comes to where I'm going to ask you this very important question real fast, and then let you really elaborate it. There's a lot of therapists out there that don't believe in polygraph testing, yet you do, and you use it very well. And we've worked very well. And I'm not just saying it because you use me, but there are therapists, and I know why, but there are therapists that don't use polygraph testing, but you use it for your patients and your clients, and it tends to help you. But I want the audience to know why you tend to like it, why you tend to believe in it, and why it helps you so much in your profession.
Where I think the polygraph is most helpful is in promoting people's honesty. So it's probably pretty intimidating for people to be hooked up to a bunch of monitors and to be set, they know as the lie detector test. And especially, so where I would refer a polygraph most often would be either for a psychosexual
Mhm.
or for a parental capacity evaluation in those cases where one parent is alleging abuse by the other side
Right.
and the other individual is denying. And the reason that I think the polygraph is valuable is just to get such a comprehensive understanding. Like in a psychosexual, the information that you provide me, you know,
Mhm.
in regard to an individual's sexual history dating back to when they, initially were
Right.
even just exposed to any kind of sexual information, their first sexual experiences, their exposure to pornography, whether they have ever engaged in any type of sexually deviant type of behaviors, I think is invaluable, especially in really understanding what an individual's um, not only interests are, but also how to best set up a treatment plan and how to establish appropriate goals for that individual.
And it helps you further treat that individual, evaluate them, and then make your recommendation.
That's right. So i- the polygraph is very useful in that way, but it also so when I do a psychosexual, I also recommend that the individual gets future polygraphs. And probation typically uses polygraph examiners. And the reason is to make sure that the individual is complying with their terms of probation and making sure that they have not engaged in any type of deviant behavior in that time
Correct.
since the prior one. Now, I was initially talking about your full disclosure
Correct.
polygraphs that provide me all of that detailed
Right.
information, but the maintenance polygraphs are also very useful in making sure individuals are complying with what they need to be doing.
Right. And let me explain that to some of the audience because of what you just said. A full sexual history, ladies and gentlemen, is when an individual has been either convicted of a sex offense and or maybe not convicted, but has been ordered to go through sex offending treatment. And they're sent to a qualified, experienced polygraph examiner who will then have to give them what's called a full sexual history. That full sexual history examination is very intense and lengthy. And then what that examiner does is a intense interview process from the time they basically were born all the way to present age in reference to their entire sexual history. And then it is then evaluated by the examiner. They're tested for verification purposes, and then a very extensive report, which I give, and I then will send it to Dr. Hollings here. And then what she mentioned is she does what's called, and I want you to explain that, she does what she mentioned was a psychosexual evaluation. And then what she does is she takes what I found on my full sexual history, then incorporates it with her psychosexual evaluation. And then, of course, she makes her final recommendation and sends it to the courts. Tell the audience what your psychosexual evaluation is.
So, as some of what I mentioned earlier, where I do a little bit of psychological testing, I do an interview with the individual, but I also do very specific psychosexual testing that includes questionnaires and viewing of certain images, as well as risk assessment measures. And all of that in combination. So I really am able to provide a detailed analysis of what the individual's sexual interests are, as well as their sexual knowledge, their sexual beliefs, who they're attracted to, as well as their risk for recidivism. Now, the Static 99R, which is the recidivism tool, that does require an individual to be charged or convicted of an offense. So, for instance, with let's say that it was in a custody matter, and they have referred a psychosexual for that purpose because one person's saying that they have been accused of anything, but there's not been criminal charges yet or ever. That tool would not be able to be applied.
Right. So you're talking about when someone is in denial.
Well, if not only in denial, but if they are not charged or convicted of an offense,
Okay.
and the other party is just accusing them,
Right.
that is somebody that cannot.
Okay.
The other time that Static 99R cannot be used is in just possession of child pornography, because there's no identifiable
Right.
victim.
Correct.
Okay, so if they, God forbid, were producing child pornography, then you could use it because there'd be a victim.
Right.
Okay, so even if a lot of times the cases I'm getting referred are individuals who are communicating on messaging apps such as Kik, where they're communicating with who they believe is a minor, but it's
not.
really an undercover
Correct.
officer.
Exactly.
But that would still constitute a victim.
Correct.
Because the individual thought
Is a real
that's
person.
That's
Right.
correct.
Thanks so much for listening. If you truly liked what you heard today, please be sure to rate the show, share with others, and subscribe for more episodes.